the medicine made my grandma's hair fall out, so she looks a little different.
My dad had well, sort of. His hair started falling off in pieces, and he was like, "This looks weird," so he just shaved it.
That happens a lot.
My grandma.
Who else's parent has lost their hair?
Well, my dad.
You guys all have this in common. Yes.
My mom has
Okay.
Not all of it.
Was it? Did it take a while for you to get used to?
Yeah.
Seeing?
Well, my dad's hair was already. My dad already shaved his hair, so but then his hair just kind of thinned, and then his beard and mustache started to fall out.
Because all the hair, is it not just your hair here, your eyebrows, your eyelashes?
Yeah. Like sometimes during chemo week, you'd see him and you'd look at him and you'd be like, huh, where's his eyebrows?
And is that something you guys can kind of laugh at a little bit?
Yeah.
Yeah. Is it so important to have some humor along the way?
Yeah.
Yeah.
I remember being scared when my dad was diagnosed with multiple myeloma. But when you're 13, you can't really wrap your mind around that kind of news. And then my mom got diagnosed with skin cancer and breast cancer, and I just remember being angry. Without even really realizing it, I started to box my feelings up. I think it was just easier than feeling scared all the time. For a long time, I thought that growing up with two sick parents hadn't affected me. But I realized that wasn't true when I moved away from home and I started college. I didn't want to do any of my schoolwork. I didn't want to socialize. I was so anxious every day, waiting for another piece of bad news. So I started looking for ways that I could help myself cope with my father's illness. And I couldn't really find much of anything. It was as if no one was even acknowledging that there are kids who are growing up with sick parents. And in talking to my sister about this, she pointed out to me that our dad grew up the same way we did. When he was a kid, his mom was sick. That's when I started to wonder, where are the families like mine? The families who are trying to raise their kids and battle parental illness. So I started searching for these families. I figured if no one was going to talk to these families and share these stories, then I will.
Okay, everything's happening.
It's all happening.
Okie dokie.
But I knew
This is weird because we have these conversations all the time.
that if I was going to ask other families to share their stories, first I would have to share mine.
Today, this thing on the bottom. So we're not going to take any black marker. Right for us, but you get to make your own. I like that. This is Miss Laura. Please put your stuff back on right. All right, look at them. We're going to use one of our pods as a trash bag.
Okie dokie.
You sure?
Yes. Listen, this is a delicate process. You can't rush art.
Jesus.
It's real hateful. I know. So what led up to your diagnosis? Why were you at the doctor?
Because I was having, for a long time, a lot of pain in my feet. I was also having, occasionally, for a number of years, significant swelling, almost ghoulish type of swelling in my eyes that would occur we couldn't figure out, for like no reason. And it would just kind of go away after about a week or so. And then it would crop back up anywhere from a few months to several months. But it was the pain in my feet primarily that did it. My regular doctor sent me to a local oncology office, and my oncologist there had to break the news to me that I had cancer, and your mom, my wife, was with me, and we had driven to the appointment separately. We weren't expecting this news when we walked out to our respective cars, and we were in the parking lot, and we stopped before we went separate ways to get to our cars, and she just turned to me and said, "You have cancer." And it's like she had to say it out loud to believe that she had just heard that, but she had a tortured look on her face that she realized that her husband had just been diagnosed with cancer. And nobody wants to hear that, no matter what level of cancer or what kind of cancer it might be. Multiple myeloma can be described as a blood cancer. It's in the family of like lymphoma and leukemia. I don't think it's as prevalent as either one of those. Normally folks are diagnosed, from what I understand, in their 60s, in the mid-60s with it. I was diagnosed when I was 48. I have the amyloid component, which is relatively rare, unfortunately, but that can attack your organs too, so you have to watch that. I don't know, I wasn't really fearful. I had done enough research to know that there was a number of newer therapies that had just come along, novel therapies, as they were called, and drugs that had been developed that were showing tremendous promise at being able to keep this disease at bay. And there were more in the pipeline. So I kept a pretty positive attitude. And again, I take that back to my mom and give her credit for keeping a positive attitude about things. I had just started my own business 5 years later. It was a lot of work, and there was more to do. So I didn't have time to feel any pity or anything. I just had to have faith and trust in my doctors. And
it was scary because it's not a cancer you understand either. I mean, all you understand is that there's no cure, so that makes it even scarier.
I think his diagnosis was especially hard because my understanding of cancer was always, it's a certain stage, and if it's not a late stage, then it's really very curable. So it was horrible to get told he has cancer, because I remember the first thing he said was, "I have cancer." And my brain thought one thing, and then by the end of the conversation, we were incurable. A 16-year-old cannot wrap their mind around long-term incurable. That means nothing to me. So it leaves you this opening to either live in this place of horrible anxiety all the time or full denial. So I feel like I just went denial for as long as I could.
Do you remember telling us about the cancer? Like, do you remember actually having that conversation?
I don't remember a lot.
Because I don't really remember a specific moment either. But, like, I think it kind of was, like, at the beginning it was very, like, Dad really framed it to me and Jordan very, like, we're gonna be okay. Like, so I didn't think that there was anything to worry. Because, like, I felt like you guys did a really good job of being, like, this is something we can fight. Doesn't mean I'm gonna die. Doesn't mean, like, so.
Think positive,
I wanted to make sure my kids understood that I wasn't afraid. I wanted to give as much good factual information without being fearful at the same time. At that point, I was thinking, is that why I had to deal with that as a kid? To see my mom show the strength that she had through her disease and what she had to deal with, how debilitating it was for her, for me to be able to say to myself, get after life. Don't worry about death. Worry about life. Because everybody dies. Everybody dies. Not everybody lives. And when I got hit with this and then thinking about how my mom was, how my mom lived as best she possibly could. So I wanted to make sure, as I learned as a kid, having to deal with what I did as an adult now, I'm going to live. And I tried to give that example to my kids. I was probably a little bit more worried about my younger daughter because you tended to hold things in. First of all, you were younger. You were only 13. My older daughter had just turned 17. but you tended to hold things in and hold your emotions in and not necessarily show things and just kind of internally process. Maybe eventually something would come out and we'd know how you're thinking about it. Yeah, we didn't know if you were letting it eat you up or you were just really strong and being able to handle it. We didn't know because you didn't tell us. That's the way it's your personality. My older daughter was almost the opposite. She immediately started asking questions and wanted to understand it more, but probably a little more concerned about my younger daughter because, I couldn't necessarily read you to know just how much it was really impacting you. And if anything, I think back then, I wish I'd probably spent more time to sit down at the edge of your bed and say, what are you thinking? Instead of just like, it's okay, I'm okay. No, what are you thinking? So I guess that's it.
What age was little grandma when she was diagnosed with rheumatoid arthritis?
I was very young. I don't remember the exact age. All I can remember is every memory I have as a child had to do with my mom having some level of this arthritis impacting her ability to move. I would say when I was probably around 12 or 13 is when it really started to impact her heavily to the point where she needed assistance in doing a number of basic things. She did her best to still try to cook and bake occasionally, clean as best she could, despite her limitations, but she was not a complainer. She went in for her therapy, which back then I think were something called gold shots, which were worthless. But so she just kept trying to be the best mom that she could be so that we as kids would be impacted the least amount possible. I think my father, as most men, especially even at that time, held his emotions in, kept them in check, and never really showed them to us. It had to impact him. He was a very proud type of guy, and it definitely had to impact him. But he didn't ever show it.
Did that whole situation with your mom and your situation at home make you feel isolated from all the other kids?
Yes.
And young adults and stuff?
Sometimes it did. My friends, when we'd be playing, whatever, I knew there was a time when my mother was going to need my help with that. One time I remember saying, I got to go help my mom bake cakes. And that became kind of the joke for my friends and everything. Ben's got to go bake cakes. And they kind of picked on me about it, but I think the parents of my friends, I don't know, for lack of a better phrase, I think they took pity on me a lot. And there was a lot of times I was eating dinner at friends' houses because they knew that my situation at home was difficult. Or I have to admit to say, maybe as a child, I was embarrassed at the condition my mom was in and other things that were going on in our house and things, the way we had to live to try to be able to deal with that. I might have been somewhat embarrassed to bring my friends into my house. It's not like it never happened, but it was rare.
What would you say were the hardest parts of having a sick mom?
Not having her to be able to get out to come to normal events that you have as a child. Everything from parent-teacher conferences to I was involved in a lot of sports and things, so I had a lot of games and things like that, and she really couldn't ever attend those things. So that kind of sucked, And it's, even as a child, I didn't care as much for myself, but I felt bad for her because I knew that she wishes she could be out there to do it and then to come out and watch me, but it was just way too hard. And then even just basic day-to-day stuff, just knowing that she couldn't just get up and go grocery shopping easily, That it was tough as a kid. You notice those things.
When she got diagnosed, did you guys have an understanding of how bad it was going to get?
No, we really didn't. It wasn't talked about, which it probably would have been better if it was talked about so we would understand it better. It was almost like, ignore it, pretend like it doesn't exist, and just make the best of it. And it was just the way life was for us. But no, we really had no idea that, of course, as she got older, it got worse and worse to the point where she really did become truly bedridden.
I remember when we were young and we would go visit her,
Mm-hmm.
it was, she was entirely dependent upon other people. Like, she could
She's
kind
right.
of hold a mug, like she could, like, just, like, kind of put
Right.
pressure on it and hold it, but, like, she had to have somebody help her go to the bathroom and help her get up, like, how long had she been, like, entirely dependent upon other people?
Well, probably from when I was about, I would say in my late teens.
When Grandpa died,
Mm-hmm.
like, was there a feeling of, like, now you're kind of the one
Oh yeah.
responsible for everybody else? Can you, like, talk about that moment, like, that realization?
I'll never forget it. I was working pretty much full time at a local grocery store because I had to pay for my own schooling, and if I wanted money for anything, I had to get it myself for the most part. But I came home and there was a detective in the driveway, and he gave me the news that he had just informed my mom that my father had passed away of a massive heart attack, completely unexpected, when he was only 53, I believe it was. And I was a senior in college and again working full time. But I remember the very first thing I thought, and I said it out loud to him, is, "Where's my mom?" Because I had to get to my mom, and I had to get to her to let her know I would take care of her. Somehow, some way. And I did. It was my turn. I have to say, when my mom passed, it wasn't that hard because she had prepared us for it, and she had prepared herself for it. She had made all the arrangements. She lived in, I think she was 70 years old, which I think surprised a lot of people. Finally, in the last year or so of her life, she really did start to go downhill, and we knew it was imminent. So when I got that phone call, it's always a surprise, but we were able to handle it. The first thing that you do with multiple myeloma, they harvest your stem cells because they can do stem cell transplant by using your own stem cells. Like, I went to Dana-Farber Cancer Institute, and you go there and it's like an oil change. It's like they're taking blood out of one arm, running it through a machine, separating the stem cells out. You see stem cells accumulating in a bag, and then they put your blood back in the other arm, So you harvest your stem cells, and like at Dana-Farber, they would store those for 10 years in case you would need a stem cell transplant.
I remember, because in Boston, they send you to the lab first, and in Boston, it's very different than here. It's a huge place where there's a cancer patient everywhere. Different cancers, you're waiting to get your blood taken before you go to the floor where you see your doctor. And I remember being so overwhelmed.
I'm sorry, I don't want to make you cry.
No, it was new, because it was so overwhelming to see all these cancer patients everywhere. I had to go to the bathroom quick and compose myself because I didn't want to do that to your father.
So it's a strong chemo drug for the stem cell harvest because they want to kill as much of the myeloma in you before they harvest your stem cells.
Did the hair part falls off? Yeah. We're gonna do it anyway. Beautiful. Dad,
run your fingers.
you're gonna need
sorry.
you're gonna need something to hairspray.
I've been spraying the extras on the whole day. I'm trying to see how to put the glue on it.
I know, he's gonna be like, no, really, it's okay.
As I was losing my hair, it was like, I was like almost like in denial. I think finally at one point, my wife and I think one of my daughters, I was sitting at a desk. In the back of my head, you could see my skull, you could see, through my hair. And they were like, come on, time to go.
Right, I go with you?
No. Just Mom. In the beginning of 2010, I started with migraines, just little ones. And as the year went on, they got worse, more frequent, to the point that I was throwing up with the migraines. And I just thought I had them just because I didn't think there was any reason. So I didn't want to go to the doctor.
After we had Cameron, or after Becky had Cameron, I mean, she went through bouts like where, it was, I'd say almost 5 to 6 months straight where she was getting sick in the morning. And I'd talked to her for, kind of for months, try to, talk her into going to the doctor, get checked out, just because it's like something's going on, something's not right.
I saw a neurologist, thanks to Rob, who said basically I was going, I didn't have a choice. And he asked me after my exam, like numerous times, and I had no idea why, what if I had any eye pain, if I saw anything's funny, and I had no idea. Like I was getting nervous, and he noticed fluid behind my eye and said I needed to see an eye specialist and I needed an MRI to confirm, tell him exactly what it was. He didn't give me any more information than that. So I went for the MRI, and they said they'd call us in 2 to 3 days with the results. And an hour later, I missed a call from the doctor, and I didn't answer or call back. So Rob got the news and had to come home and tell me what they found.
It kind of happened all very quick. I got a phone call at work. It was like late in the afternoon, probably like 4 or 5 o'clock. And the doctor's telling me about this AVM and what they found. And I have no idea what they're talking about, obviously, because, especially as being as rare as it is. So I didn't get any kind of good information other than the fact that I knew I was like going home right then and there to tell her that something was up. I usually never come home early. So like the second I walked through the door, she was like almost instantly in tears and wanted information what the doctor would say. Now the doctor's office is closed, and I had absolutely no good information. So
he came home at the same time as me and said the doctor called, and I was like, just don't talk anymore. And he didn't have all the information. He couldn't grasp it. So the little he gave me was what he kind of took in, and he just felt like, I think, just shocked and in disbelief that there was actually something there to explain why I was feeling the way I was. An AVM is like a aneurysm. The difference is it's a cluster of arteries and veins that didn't form correctly when I was in utero, growing. And you can live your entire life never knowing that they're there. You could be in an accident and then do a scan and find it. And if it stays small without symptoms, you can go your whole life without having to do anything. In my case, some trauma to my body caused it to grow so large, which is what made all the symptoms come. And most people don't find their AVMs until they have a seizure, a stroke, or it ruptures. And thankfully, I haven't had any of those. So I consider myself extremely blessed that I only suffer the migraines. As bad as they are, I'll take those over the other options.
Even driving home, trying to think what I'm going to say, how I'm going to say it. And, the doctor's, of course, talking to me like, I know perfectly well what he's talking about.
I honestly felt like the world was like ending. It was like, how does it happen to a mom who's 28 with a 2 and 4-year-old? It was terrible. Like, I think I cried all night long. I can still feel it. Like, 8 years later.
When is Dad getting home?
Soon.
He's almost done working.
Connor, you're gonna answer more questions than I probably will.
I was thinking we do flip flop every question.
She tells you what to do.
How about you just answer them all?
I know that you were both really, really young when your mom got diagnosed with what she has. So you guys don't remember. You guys just remember life always kind of being your mom having something, or do you remember anything before?
When I was in kindergarten, I would always have to stay at my grandparents' house a lot. Like, because she was so sick that she would have to be in the hospital for days and nights.
I remember one Easter she had to stay in the hospital.
How do you guys feel when she has to go into the hospital?
Worried and sad to see like how she is. Because like a week ago, I think it was, she had to go for a medication. Like, she was allergic to a medication, and I was kind of worried because like it was making her really sick.
I mean, I honestly don't think we even brought it up to them for the first couple of years. We did talk a little bit about, talking to them about it and, just making them aware that, mom, there is something going on with mom and mom is sick. And, especially, it's rough always, with her having headaches when constantly telling the kids, quiet down, don't do this, don't do that. Mom's got to rest, and it was, well, why? It wasn't fair to them to not, have them be in the loop as far as what's going on and why does mom need to rest and, why do we got to be quiet around mom,
I felt like I was living a nightmare that like my kids were going to find me after it ruptured and they weren't going to know what to do at 2 and 4. They didn't know how to call 911 yet, so we had to do that. So I was just worried about not letting anything bad happen to me with them because I was home with them all the time. It just was, you worried every second. Every headache, was it a rupture? It just was a nightmare.
There'd be times for me, even, the first couple of years, I would be at work, I'd call, check in on her. She didn't answer the phone or I'd call back. I was rushing home, just to check on her because honestly, assuming possibly the worst. You just didn't know. So, there was definitely a lot of that in the beginning.
I had an angiogram to get a better picture of the AVM, which took my doctor 8 hours to review because he couldn't see part of the brain because the mass was so big. It showed that I had a lot of feeders, which are the arteries feeding it blood. After the angiogram, my symptoms got worse, and it wasn't you have time to treat, it was you have to start treatment now. So it was hurry up and this is what we're going to do to stop these feeders and hopefully prevent a rupture.
The game plan was to basically shut off arteries that fed this mass blood and in hopes that it would shrink it. And she went through 9 of those procedures as far as embolizations. And each embolization shutting down anywhere from 2 to 5 arteries at a time that fed that mass blood.
Do you feel like your mom tries to sometimes hide from you how she's feeling or her symptoms or anything like that? She wants to protect you.
Yeah.
Yeah, sometimes. So because she doesn't want us to worry a lot.
Do you think that you're kind of good at telling if she's not feeling good? Or
Yeah.
Do you guys worry that your mom worries about you a lot?
Yeah.
Yeah.
Is there anything that you'd like to say to her to kind of...
She should really worry more about her health and how she feels. And we should help out a lot more.
To know that like we're not mad if it's a no, like that we can't do something.
That you guys just want her to be okay.
Yeah.
That you understand.
With Cameron, I think so he was 2 when I got diagnosed, and it's worrying about how he's handling it, and because he stresses the most. He knows when I have a headache, and if he knows it's been days on end or months, he physically gets sick.
Hearing you talk about that you could die at any minute made my stomach get a lot. It made me a lot worried.
I don't worry about that anymore.
Like you could have a stroke at any minute or a seizure.
My AVM is stable now, thankfully. Kids shouldn't have to do.
No, they definitely shouldn't.
I'd worry for the same for Connor. I mean, he doesn't voice it as much. I mean, he's very much the one that keeps everything kind of bottled inside too, which kind of worries me too because he's not prone to talking, at least to me. I mean, he does more to Beck as far as opening up with that kind of stuff.
But with Connor as well, it's when he's feeling down from it because he wants to be right next to me and he wants to be helpful, and if I go to the doctor he wants to be there, or the ER or be at the hospital, he wants to be right there with me. He doesn't want me to be by myself.
Like sometimes, like when she's super sick, like I have to like help her out. Sometimes
Get her medicine.
Yeah.
Like, we can't help with much things because she usually tries to do it by herself.
So right now, what's your current health status? You're just monitoring it?
We're just monitoring the AVM. I'll go back to the doctor in 6 months unless I have to go sooner. It's basically just trying to get through each day with a migraine if I have to. Like today I've had a horrible one all day, but life doesn't stop because you have a headache. And it's not just a headache, but I still have things that I want and need to do, but at the same time, being a mom and having all those things, even on the bad days, is what gets me through each day. Otherwise, I'd probably curl up in a ball and sleep all the time. So right now, just focusing on making it through each day until this thing is gone.
Now you have a migraine right now?
I do.
Some of my friends all, get whatever they want anytime, and we have very many limits of what our mom can do. Some people that don't know about it, they make fun of your parents, cause they're always sleeping. They always make fun of me for having a parent that can't do a lot of things.
Okay, so then when you got diagnosed, why were you at the doctor?
I decided to go to the dermatologist because I had this weird bump on my elbow, and it was like, it reminded me, it just looked like a blood blister. And I just thought, you know what, let's just get that removed. So I went to the dermatologist. They removed it right there in the office, removed it, put stitches in. She said to me, it looks like a fatty cyst. I don't think you have anything to worry about. So I wasn't worried. I had to go back a week later, get the stitches out. I was by myself because I did not think I had anything to worry about, or I would have had your father go with me at least. I'm in the room waiting for her, and the doctor walks in the door and says, "Oh, honey, it came back, it's cancer. You have melanoma." And of course I start crying because I'm like, in my mind, I've never heard a good thing about skin cancer or melanoma, that there's not a cure for that either.
When Mom was diagnosed first with her skin cancer, I played off from her emotions, and she was very scared. So I got scared. I started asking your mom some questions about, okay, well, what'd she say about this? What'd she say about this? She didn't say anything. She just said, you've got skin cancer. Here's a doctor we're going to go see. We set an appointment. And that was it. So we went there, and sure enough, her doctor there was outstanding at New York Langone Hospital.
In New York City, they did a surgery where they actually have to remove around the skin cancer too. They have to remove enough and go in to make sure it hasn't spread, and just to make sure they got it all. And when they do that, they also check the lymph nodes. And it came back, it wasn't in the lymph nodes, so that was good. And it came back, what they do is they test it, how deep was it. And mine was actually the deepest on the chart of what it could be. But because it wasn't in the lymph nodes and it hadn't spread and they got it all, I was actually blessed enough to I didn't have to do any treatments for it.
So then talk about how you found the breast cancer.
Well, thanks to the doctor in New York City, because my melanoma was so deep and the highest level that can be on a chart, he got me approved to get a PET scan. I got the PET scan, I got through my melanoma, but when I got the paper telling me the PET scan results, it did say something about my left breast, and I was like, you know, he didn't seem concerned, but I wasn't gonna let that go. So when I got home, I saw my doctor, and they had me get the ultrasound and MRI, and they did see something there, so they had me get a biopsy where they go in and they actually take a sample, which is not a pleasant procedure. That came back breast cancer, so I got diagnosed with melanoma in May and breast cancer in August 2012.
By that time, I was in my regular treatments and they were working. Okay, so at least it was in what we call a stable state for me. So I had a relatively normal life going on for myself. I was a little more concerned with her until we got to New York. So there was a short period of time that we had, you know, what's going to happen if something happens to both of us, and we talk about, well, what should happen with the kids if that's the case. But that didn't last too long.
I was living in a place of denial. So like even though I was very stressed and very anxious, like I was sort of just like living in this place where I was thinking, this will be very minor. Mom will be totally fine. Dad will be fine for a really long time. I won't have to deal with it until then. I can be normal. It doesn't have to be a thing.
To be honest, it was one thing after another, and I think all of us just were becoming numb to more bad news. It just became a point when we're like, what next? You know? But because it was caught so early, I was very blessed to not have to go through chemo or anything. And I have to be honest, I actually have guilt over that. I mean, like my mother had breast cancer. She had to go through all those terrible treatments, and other people I know. And my breast cancer did not show up on a mammogram yet, and it probably would have took a few years. So by the time it did show up, I would have had to have treatments, and who knows what stage it would have been at. I chose a double mastectomy because I just know, I mean, even talking to the nurses in the hospital, I had it done in New York, that, you know, they're like, you're making the right choice, because we see so many patients who get the lumpectomy and they're back in 6 months, they're back in a year, they're back in 2 years with breast cancer again. And I just chose to just take it all. And I had to just be on a medication for 5 years. And in fact, this past year, 2017, was 5 years, and I was able to go off the tamoxifen. So I'm off the drugs, which is awesome.
And you're completely cancer-free?
Knock on wood. Yes, I am.
So now do you worry about your own health, or do you mostly just think about Dad?
I don't worry about my own health. I get my checkups. I'll get any checkup they'll give me, you know, and I want to be here for my kids. I want to be here to take care of Ben. And you got to do what you got to do.
It's almost like, in a way, the skin cancer was like a blessing,
Oh,
you
yeah.
know, because it was like a way to get the doctors to pay attention enough to make sure that you were going to be healthy in the long run, you know?
Yep.
My name is Rebecca Skolnick. I'm a licensed clinical psychologist and the co-founder of Mindwell NYC. My mom was diagnosed with scleroderma right after I was born, about 3 months after. She had systemic diffuse scleroderma, which is a chronic connective tissue disease. So with that, she had many complications, Sjogren's syndrome, kidney transplants, all kinds of things. It was interesting because it was my normal life, like I was born into it, so it didn't seem strange to me. Sort of in the back of my mind as I grew up, I was always afraid that she may pass away or just something might happen. It was definitely anxiety provoking, and I feel like I had to deal with really challenging things from a young age that, you know, unless you've been through it, you know, a lot of people don't have to face. But I also think it helped me become a lot stronger and kind of put things in perspective. So I think there's benefits, but it also was very challenging sometimes.
Can you talk about that first piece of advice about being honest?
So my mom was really all about being honest about what she was going through, which I think could be a challenge, especially as I was getting older, and it's at different ages there are different things to be honest about or different ways to talk about it. But I think it's so important for parents to be honest and open with their kids and with others too. Otherwise, I think it leaves room for people to wonder what's really going on. And the kids can often feel really disconnected from their parents. Like they know there's something happening. You can't really hide it. That means my mom would show me when she took medication. I would sit with her when she did physical therapy. I went to her dialysis unit when she was on dialysis and I was like 3 years old. I went to the hospital all the time when she was there. You know, it's just really important for the kids to feel connected to their parent and to feel like they can have a relationship with them regardless of what's going on. So being honest is really a key to that.
And then can you talk about the next piece of advice, explaining your limitations, but focusing on your strengths?
Yeah, so I think, my mom gives some examples of doing that where, she talks about how she couldn't open a jar, but she said she would try and things like that. Focusing on strengths it's so challenging, I'm sure, for the parent, but also so important for their own mental health. If they kind of get focused on what they can't do, they're more likely to become sort of a patient and really identify with being that sick person. So I think it's helpful for the person going through the chronic illness. And also for the child, it models coping, it models being able to stay positive in a not so positive time. There is research to show that being positive and staying focused on strengths helps the whole family kind of adapt and cope with what's going on.
And now can you talk about allowing your child to be a child?
So I think this is really important in kind of making sure that the illness doesn't take over the entire family's life. So of course there are going to be times where it's the main focus, but allowing your child to play, to go to school, to join extracurricular activities, make friends is so important. And there's a lot of research on this idea that extracurricular activities can really help the kid gain a sense of normalcy and routine and control, and also find ways to cope. We all need things to do to be able to manage all of our feelings. It helps create a little bit of distance so that they're not always with the sick parents or always talking about it. It gives a little space, which is important. And social support, meeting people through other activities or just being able to hang out with friends or go on play dates, depending on how old you are, I think is really, really valuable. It's really important for the kids to start to develop their own social network and support as they go through things.
And the next one, discussing your medical care at a level that they can understand.
I think this goes along with honesty and being open. Kids are going to have a lot of questions about what's going on and concerns. And the more they know what's happening and can understand it, the less anxious they're going to be about how grave is this? Is this, is she going to die? Is she not? Like, what's going on? So I think it's important to talk to kids about what's happening and in a way that they understand. My mom, I think, gave an example in the article about describing a hospital as like a large doctor's office where people sleep, which I think is great because it's scary. There's a lot of beeping. It smells weird. It's a lot of chaos. And so just saying like this is a place where people get better. This is a place where doctors help people. Talking about medicine and saying like this is to help me get better. I think the more kids understand, the less likely they are to have sort of these appraisals of what's happening that are not accurate. And for anyone, the more uncertainty they have, the more anxious they're going to be. So I think on top of understanding what's going on, it also helps kids feel connected again and helps the relationship continue.
And then avoiding disruptions in your child's routine.
The idea is as much as possible to have the kid be able to do things that other kids are doing. So going to school, seeing people. I think, while there is so much chaos going on and a lot of uncertainty, if they know like every day I go to school at this time, I come home at this time, I have this after school thing, it gives them a sense of control and some normalcy where it's hard to find.
And then the next part, I wanted to discuss anxiety and depression and just how you can recognize that in your child and what are some signs that there might be something going on you should try to help them with.
Anxiety and depression can look similar. They can look different. You want to look out for your child being tearful. Sometimes depression kind of masks itself as anger or irritability. We also want to look out for kids not really enjoying things as much or expressing interest in things. They might refuse to go to school. They may be really anxious about separating from their parents, so they may not want to sleep alone. They may be having nightmares. They may stop talking to some people, even though they know how to talk. They might not want to go to a friend's house or go away, like go to camp or things like that. They may have physical symptoms like headaches, stomach aches, or they might have panic attacks, which would be like all of a sudden they would have their heart beating really quickly, they would have trouble breathing, things like that.
If someone thinks that there's a student in their class, or if they recognize in one of their own children one or any of these symptoms, what would you recommend that they do to try to help their child?
I think the first thing is to talk to them about it and just kind of just see what's going on and try to get them to talk about their emotions as much as possible. You know, they may not say I'm anxious or I'm depressed or I'm sad, but just to say, you know, I noticed this behavior, or I noticed you're not eating as much as you were, or I noticed you don't really want to go to school. Like, what's going on? So I think first we want to try to get some information about it and know that, you know, the parent is there for them. And then I would recommend getting a consultation with a psychologist or a psychiatrist. Psychologists help with therapy and psychiatrists help with medication. But I think either way, they can help to assess, is this like clinical depression or anxiety? Is it normal, you know, given the situation, right? Because it is normal to be anxious and sad when you're dealing with a parent with an illness. But when it starts to interfere with your functioning, like you can't go to school, or you're not talking to people or making friends, or you're not doing your homework, those kinds of things are where we start to think, you know, maybe there's something more serious going on. Some things that are really important and helpful for parents to keep in mind that, you know, both we know from a research perspective, which although there's not a lot of research, it's what we know, but also I think from my personal experience I can speak to, it's really important to try to build that parent-child relationship between both parents and the children, and especially the parent with a chronic illness. So that might mean being open and honest. It might mean having the kid join you for your therapies and things like that. It's just really important that the parent really tries to be there and be positive when they can. So if the parent is having depression or anxiety, which is totally understandable, it's important that they also seek help because we know parental depression can have a big impact on the kid's ability to cope, on the kid's ability to understand the situation or even understand their own emotional experience. So as much as parents can be present, connected, get their own help and avoid avoidance, you know, really letting the kid be a kid and do things. I think all of that really helps the family to cope with something that is really hard to cope with.
Yeah, whenever you're ready.
Oh, okay. You were on?
Mm-hmm.
Okay. Hi. Actually, before I was diagnosed, I was a fitness instructor. I was very much involved in the fitness field. It was a career I chose to balance being a full-time mom and having my kids with me. Eventually, what happened is I started getting joint pain, and it was body-wide, and it started to concern me, and I thought, well, maybe I need to have this checked out, thinking it was probably overuse injuries. And I went to see a rheumatologist, and he decided he was going to work me up for a variety of connective tissue diseases. And the result of that test showed that I had the precursor to multiple myeloma called MGUS. And at that point, that was the beginning of the journey of watching me very closely, because there was no signs of an active disease, but signs that it could become active. I'd never heard of the disease, and my ex, who was a physician, had heard of it, but had not spent a lot of time studying it because it was so rare. So I didn't get too bent out of shape about it. The only time that I got a little nervous perhaps was just prior to going in for one of the biopsies, because I knew they weren't fun and I wasn't looking forward to them, or to when I would be waiting for the results of the blood tests. Those were the moments when reality sank in, but it was very brief because I had a very active life, very involved with my kids and my family and the community. And so I couldn't let something like this affect the quality of my life.
How old were your kids when that happened?
My son was 3 years old and my daughter was 7. So they were awfully young, and I didn't think, nor did my ex think, that it was necessary to inform them or share with them what was going on. They wouldn't understand anyway. You know, you want to shield your kids as much as you can until and if such time they need to know and understand what's going on, that's when you deal with it. But until then, we just didn't feel there was any reason to. One of the times that I had to go into Denver for a biopsy, one of them questioned why I was going in. And I think that's the first time I realized I needed to share something with them. So that was the time that we told them that I, had something that we watched closely. It wasn't anything to worry about, but these annual tests were to make sure that if anything were to pop up, that we would deal with it and everything would be fine. And that went on until 1997, when the tests came back very positive for multiple myeloma.
We were sitting on our bathroom floor, and this is it's a very vivid memory for me. My dad and mom were like, okay, we need to talk to you about something. And it was clear there was something wrong. They brought my sister and I into their room, into their bathroom. I don't know why the bathroom floor was it, but we were sitting down in the bathroom, and then my parents explained to my sister and me just about what multiple myeloma is, and talking about cancer, and talking about kind of the precursors that my mom had for a number of years that I didn't really know about, I don't think, or at least if I did, I don't have any recollection of it.
I explained to them what was going on, what the diagnosis was, and that I would be approaching the need for chemotherapy, and that it would all be fine.
I don't remember the first time that she told me. Given that they were trying to protect us, I think so much of it was just, we're just checking things out, making sure everything's okay. And it wasn't until it became full-blown myeloma that it was really a question mark. And then I don't really remember that conversation. I think the only big conversation I remember is it started getting really bad, and we started talking about a bone marrow transplant. But until then, there's no distinct one moment that I can remember.
I was about 13, 14 years old at the time. I think maybe a freshman in high school. And that's really my first memory, I think, of when my mom, actually had cancer. I'm not sure even I knew or fully could comprehend what it meant as a 13 or 14-year-old. Or maybe it was just my own reaction. I just went straight to denial and straight into compartmentalizing my emotions, which became kind of an unfortunate habit.
And then it was determined that I would need a bone marrow transplant, or at least that's what I was told when I went down to Dana-Farber to meet with the specialist. The fellow said, well, it looks like you're going to need a bone marrow transplant within the next 4 months, or you will be dead in 2 years. Those are his exact words. And I took it in for a couple of minutes, and I looked at him and I said, all right, so what other options do I have? And he said, well, there is something called a autologous bone marrow transplant, which is actually a stem cell transplant. And that is where they harvest your own cells and they clean them up and they give them back. It's a type of bone marrow transplant, only you don't need a donor, you use your own cells. He said, it's in experimental phases, but once it's tried and proven, it has a much better outcome. So I looked at him and I said, okay, then we're going to wait. Because I believe that there's got to be something else out there that I can take advantage of until this stem cell transplant becomes available. And I believe the fellow was shocked. And I said to him, I'm not going to be a statistic. So after that appointment, we decided to do some research. And during that research, we discovered there was a treatment, a chemo treatment called Iridia, which is a bisphosphonate. And that it had very promising results with multiple myeloma and slowing it down. So I approached my oncologist and asked him why I wasn't on Iridia already, because it had been available. And he said, there's no reason why you can't be on it. And I said, well, let's get it started. After 4 years of the Iridia treatment, it stopped working, basically. And the myeloma just went crazy. And I went in for a full battery of tests. I went through everything. The results came back pretty significant. In fact, as my ex described it, because he could read x-rays, he saw the x-rays and he said my bones looked like Swiss cheese. At that point, my physician said, okay, it's time. We need to do something. May of 2002, I started the journey to get ready for a bone marrow transplant.
That was when, she said, the disease is progressing and we're going to have to go through this. They explained the odds of being, like a 40% chance of mortality. And it just, at that point, it became very real. And I think I remember distinctly a question that she asked that was, what do you want of mine? What would remind you of me and what would you want to have with you? My brother said that he wanted her perfume. And I felt like that was just a sad thing, that he just wanted to be able to smell, and remember that smell and have that with him.
It started out with 3 months of 7 days each month, inpatient high-dose chemo. And it was pretty grueling. There were big changes going through that chemo. That's when I lost all my hair. And at the same time, I was on high-dose steroids. So I would go through these roller coaster rides of highs and lows and feeling very energetic and very exhausted and very sick. Rachel had started college and Scott was in his senior year of high school. I imagine it was really hard for them. And I was worried about them, but I think I tried to protect them as much as I could, even though maybe I didn't need to. And then I was admitted on October 29th. And on October 31st, Halloween, they gave me back my cells. And all that is an infusion of your cells, an IV infusion. And then for quite a few days after that, I was out of it. At that point, it was all about isolation and not being exposed to any kind of germs. So anybody that came in had to wear a mask. Anything going in there had to be sterilized.
I was at college and, I would have moments where I would go in. I had a single room. I would just go in and, get on my futon couch and, curl up in a ball and cry. And I had really supportive friends who were there for me. And I had to kind of decide, do I just keep going or do I go back and be with her? And so ultimately I decided to keep going, but I was driving back and forth and I was at the hospital as much as I could be. And, my senior thesis ended up not being written anywhere near when it needed to be because it was more all consuming than I gave it credit for.
At that point, I was applying to colleges. I was running cross country. I was gone multiple days a week. I think I may have even been in theater at that point. I was basically doing everything I could to keep myself occupied. And then on top of that, my mom was at Dartmouth. My dad, when he wasn't working, was basically traveling down to Dartmouth an hour and a half to see her. And so I was on my own a lot. I guess the first time I really saw and felt emotion during that process was when one Tuesday, my dad was like, why don't you come down and see your mom? It's okay. She's been out long enough. You can come down and see her. And so he took me out of school and we went down and we surprised her and she wasn't expecting it. And she broke down seeing me. And of course, then, I started to feel emotion just at that site because it's hard to see your mom so weak and in such a state, vulnerable. But then again, after that, I just bottled all those emotions back up.
We always felt that college was for developing socially and mentally, and definitely succeeding academically, but also exploring your social life. And so it was really hard to succeed at all of those things while also knowing that my mom's life was just constantly kind of hanging in the balance. It was really jarring to believe that there's a possibility that she would no longer be with us. To see her deteriorating, and as she lost her hair and as she started to feel a lot of pain and to be sick, it was just such an emotional experience that it necessarily bled into everything, and especially in my college. Again, it was very difficult to sit down and concentrate on a thesis if you're going through this. The social life was certainly a good distraction, but as soon as the door closes, you're alone with your own thoughts, and that's when it really starts to creep in.
She came home early. Like they were really optimistic about her recovery time. Of course, when she got home, she struggled a bit.
So I went home and I immediately fell onto the couch and in the living room and pretty much stayed there. And I was very weak and I couldn't eat. And then every day I would force myself to go up and down the stairs, go outside, walk the driveway, walk a little further, come back each day, baby steps. I kept saying to myself, and my doctors kept saying, baby steps.
Before the transplant, when you realize what's coming, and then during the transplant and the little bit after, you're constantly in limbo. You're wondering, where does life go from here? Are we ever going to get back to a point where, we were this family, this strong, vibrant family with our mom who was always active, and, is she ever going to have that again? And to see every little step of that recovery, a lot of hope that was attached to that. Maybe we get back to a place where she can be an active member again of the world.
And so I would say by early spring, I was doing pretty well and pretty much able to take care of myself and start to feel some semblance of feeling normal.
Stem cell transplant was always thought of as the first line of defense. That if the person is a candidate for his first transplant, a lot of people are, that's what you do. When I was diagnosed, it was just becoming, these new novel drugs were really working. And so there started to be the debate about, well, what's the right thing to do? What's the right first step in treating this? So I didn't do a stem cell transplant right away. I didn't want it. To me, I believe that medically, you do what I've learned through everything I've been through, do the least radical medical thing possible, because that's what's best for your body. And at the time, the least was taking a pill every day.
So they wanted you to get a stem cell transplant, and you
It was
decided to just
strongly
stay on
suggested,
Revlimid?
and I said no. Right, I stayed on the Revlimid. To my doctor's credit, who I love, up at Dana-Farber, he agrees, okay, we'll go on the Revlimid. When I was first diagnosed and put on the Revlimid, there was thought that blood clots could be a side effect, but I was never prescribed a blood thinner, and I should have been. And who knows, maybe I wouldn't have had problems, but in 2014 I started having some issues with blood clots. I actually had to have parts of toes amputated. I had to be off my Revlimid, my cancer therapy, quite a bit because it hindered healing. My myeloma started to climb, indicators started to climb a little bit. So my doctor was like, how about we do the stem cell transplant? We tried Velcade. He wanted to do that before the transplant to try to knock the cancer back as much as we could before the transplant. But that drug was known to potentially cause neuropathy in your hands and your feet. After just 2 intravenous sessions of this Velcade, my lower legs and feet were destroyed. Complete total neuropathy, to the point that it was just horrific. I'll never forget waking up one morning soon after that hit me, and how I was thinking, oh my God, am I going to be like this for the rest of my life? Because I couldn't feel my feet. couldn't feel my lower legs at all. I always say it feels like your legs weigh 100 pounds each, and that they're wrapped in several layers of linoleum, and it causes potential falls and things like that. But yeah, the Velcade destroyed me.
Just as my senior year of high school was starting, my dad had his stem cell transplant. And my mom was staying with him in Boston where he was having it. So I was home alone. And that whole year when my dad was recovering, I just felt so separate from all my peers. I didn't have any motivation for my schoolwork. I was missing classes. I was not turning in assignments. I lost all my friends because I wasn't socializing like I used to. Everything just felt so uncertain. And I was scared. But my whole family was hopeful that this stem cell transplant would give us a period of remission, when my dad's cancer wouldn't be our main focus. But unfortunately, that's not at all what happened.
Just a couple of weeks later is when I got the infection in my leg and my foot that went sepsis and almost killed me. My wife was actually massaging coconut oil because of my neuropathy into my legs that evening, and she noticed a little red mark on the outside of my right ankle, and that was it.
I didn't see an open wound or nothing. But I mean, it did look like they don't know if he got bit by a spider. They don't know if he hit his leg on the car and didn't know, but I saw no open wounds. So I get up the next day and he's in the sunroom. He still has a temperature, but his ankle is all swollen and red. So he had left a message for the doctor already, because I said, first thing you gotta call, tell me I have a fever, you need an antibiotic, whatever. And I'm freaking out because I see his leg and he still has a temperature and he's you could tell he's sick. So I call the doctor back and I say, I need to know what's going on here. And I tell them what's going on, and they said, take him to the ER. And I can tell you right now, if I had taken him to the ER, he would have died. He would have died at home.
And I didn't even realize it, but I was in shock because I don't remember anything. I don't remember anything from that day when she had to rush me to the hospital finally and basically almost carry me into the emergency room. I don't remember anything until I woke back up, whatever it was, a week and a half later, because they had been incubated into a coma to deal with this. And I remember being in my face saying, you almost died.
He couldn't barely walk in. I parked the car, he's holding on to me. I'm like, hon, walk, come on, move. He couldn't hardly do it. So I get into the emergency room and they see me struggling with him and they run out with a wheelchair, which I appreciated. And they took him right to a room. They got him right on IVs, they got him blood work right away. But in the emergency room, he kept panicking because he was having trouble breathing. He get the nurse. And he was like, it was scaring him. I had to get the nurse twice. And at that point, they decided to call the doctor in who would do ventilation and talk to us and say, we think we should put you on a ventilator because you're struggling and it'll make you more relaxed. And, because it was really scaring him. Because think about it, if you have trouble breathing, it's pretty scary. So they put him on a ventilator right there in the emergency room. And he ended up on it for 9 days, which was the worst thing ever to see your husband on a ventilator. Because for one thing, he got all this, they're giving him fluids. And he got all this fluid and he became enormous everywhere, including his face. The ventilator straps were so tight because it's not a way you want to see your husband or you want your kids to see your father. I get to the emergency room after they call me and tell me his kidneys are going into failure. And I said, should I get my children home? They live in California. I need to know if I should get my kids home. And I could tell by their faces that, yeah, get your kids home.
How hard were those calls to make?
It was awful. I felt so helpless.
No, I'll never get that image out of my mind. I'm sure you agree.
Yeah, definitely.
The most disturbing part of all of it was that he wasn't fully out. Like, he was tied so that he couldn't pull out the breathing tube, which is like your instinct. Like, his eyes would roll, like he would look at you, but he's not there, and he's your dad. You don't truly think about what it's like to see, especially a parent, like that.
I remember the morning I went in and he was off the ventilator. And they had tried the day before and they couldn't get him off because he wasn't breathing right. Because the longer you're on a ventilator, the worse it is to get you off. So I know that they want to get you off as soon as they can, and he was already on it 9 days. So that morning I remember I walk in and he's laying there, he's asleep, you know, his eyes are closed. He doesn't have a ventilator, and I just looked at the nurse and I grabbed her and I hugged her. It was like, you know, it's crazy.
Once you've experienced the desperation and the sadness of sitting crying in an ICU room, like with your dad, like half alive, you're playing Frank Sinatra and Dean Martin because he loves it, and you're hoping it'll like wake him up or keep him alive, or like he'll hear it on some level, but like there's also this element of like growing up, we would always listen to that stuff together. You know, like there's nothing like that feeling. And so even though I left it not really thinking like that was traumatic, like I just think my body just like internalized it.
Soon after I woke up and your mom was in my face and I saw all the activity like around me, I was back into a regular hospital room. You know, up until that point I hadn't been in the hospital very much. Since that time I've been in the hospital way too much. Initially I was like, after I understood what had happened and had been describing what had happened, I was very thankful to be alive, and I was ready to get back living. I saw that my leg was a mess. It was destroyed, but I still had it. And I had a local wound care doctor who was going to work to try to make it better. And at that point, to me, it was like, okay, well, that's just what it is.
I remember I sent you guys a picture of the first time they got him in a chair out of his bed. Like, Dad's in the chair today. You know, that was hard work to get from that bed to a chair right next to him. Because, I mean, you if you lay in bed for one day, your muscles just atrophy, you know. So he had to learn how to walk again. And he did great, though. I mean, he did great when we left the hospital and they started coming in with physical therapy. And he did great walking, so with a walker and everything.
You know, when I got home, I was a complete mess, and your mother was pretty much just taking care of me.
So how many times did you have to go back to the hospital because of your leg that you were trying to save?
Oh boy. Due to reinfections as we were trying to save it, my goodness, 3 or 4 times in 2 years. And each time was at least a week stay, sometimes 2, depending upon the antibiotic that they wanted to put me on.
See, you gotta know too that me having to take care of it, I also became the person that was like, is it okay? Or should we go to the hospital? You know, like, what if I screw this up? You know, like, what if that's an infection and I don't realize it? Like, hello, I'm not a nurse here. I mean, we went to the emergency room a couple times just because I knew, you know, it started getting black again in spots, you know? So I knew we have to go to the emergency room, dear, I'm sorry. And of course, you know, he hated it.
I got a lot of women in my life that I don't know what the hell I do without them. Throughout a large part of my life, from my mom to some women that worked for me and with me to, you know, obviously my wife now and my daughters, of course. Without all these women in my life, I'd have been screwed. I remember being concerned that to get that healed up, how was I supposed to be on my treatment for my myeloma? And I couldn't be a lot of time, which wasn't good. As we found out during that 2-year time period, they were trying to save this leg, and I couldn't be on my myeloma, any kind of myeloma treatment. As a result, the myeloma progressed into my body and it ended up impacting my bones. I ended up having lesions all through my bones, and I ended up started breaking bones like crazy 2 years later, hence, which ultimately led to the amputation. Because I had actually broken my tibia while we were trying to save it. And just when I got the green light to go start walking again on tibias, when I broke my ankle and it wasn't fixable and we had to amputate. So it was like 2 years trying to fix this leg. And we did, but by doing so, we had to get off of myeloma treatment that allowed the myeloma to progress, and we had to take the leg anyway. So
3 weeks after the amputation, he broke his femur. You know, just standing up, he heard a snap. You know? So, I mean, he broke, what, 1, 2, 3, 4 bones in a couple of months. a few months.
Since that time, I've gotten on a bone strengthening drug as a part of my regimen, and we can see that it's actually healing, and healing pretty well.
Can you talk about when you first stood up on your prosthetic?
Yeah, well, that was at the place that built the prosthetic for me. With their parallel bars and stuff, it stood up and kind of got going on that. It was great to be upright again and to be standing tall. I couldn't walk very good because I had such muscle atrophy in my legs from being on my butt for 2 years. Really made it very difficult. And, prosthetics kind of heavy, so that doesn't help either. But I was able to take some steps, so that was nice. And I felt good to be able to stand up and get work. But then I realized, man, I got work to do.
So what's the status of your cancer currently?
Currently, the latest test, and I go, again, this week, I go for a biweekly infusion of daratumumab, or Daralex is called by the brand name. It's one of the newest therapies. I go every other week, and I had responded very favorably to that initially. Lately, my numbers have started to climb, so we got to keep an eye on it because things have started to climb a little bit again. That's the way this disease works.
Can you just say how it all started again and why you guys went to the hospital?
In the morning, you have to take your father off dialysis because that's a nighttime thing.
Mm-hmm.
And part of taking him off dialysis is checking his temperature and all that stuff.
Yeah.
And he had a slight temperature. And then when I got him downstairs, down the chairlift and everything, he had to go I took him to the bathroom, and I couldn't get him off the toilet. He wasn't strong enough to actually sit up from the toilet, and I wasn't strong enough to hold him at the same time too, to try to get him off. So I called an ambulance.
Uh-huh.
Now, when I took him off dialysis, I also noticed that he had a red rash on his leg, which I knew was not a good thing.
Yeah.
And it was very warm. So we went to the emergency room. They got him right in because they could tell from his blood work and everything that he had another blood infection. We get him in his room. He's pretty much out of it because he was just so weak and his blood work was terrible. And they wanted to put him on a ventilator again.
Yeah.
And so they got him set up on dialysis, and they got him on a ventilator, and I stayed because his numbers improved a little bit, like his heart rate and all that stuff.
Yeah.
So I went home for the night, and they called me at, I think, 3:30 in the morning that they were doing CPR. And I got to the hospital, and they were still doing CPR.
No, it's okay.
And, of course, I was hysterical watching that. Ugh.
Yeah.
And the doctor finally came out to me and said, we've been doing it for 15 minutes. I have to make the decision. Do we stop?
Yeah.
At that point, I said no. And they had me come in and talk to him and and he did open his eyes once. And, I told him to fight and all that stuff. And they had me leave the room because they had to do more. And then they came back out. And, it's been, long enough where obviously it's time to stop. But we got to let him go. And I'm mad. I know. I just can't say the words, but I finally did. Kissed him goodbye and,
But I always just feel so guilty that I wasn't there.
Well, you can't. You guys can't. You got to live your lives. We can't, people grow up and move, and that's just how it is. And, we didn't expect him. When I left, talked to him, he said, when they put him on the ventilator, I told him, it's all right. We'll get through this just like we did before. It'll be okay. I tried to reassure him. I mean, I have guilt. Maybe I should have had him call you guys just in case, but, nobody wants him, but that's going to be it,
Yeah, of course. None of us were like, this is it.
Right, and we've been through so much, before they put him on the ventilator, I told them, you got this.
Yeah.
Don't worry, it's just another thing we'll get through. And, I didn't expect to go home and have to come fly there as fast as I could in the middle of the night. There's a lot of what ifs with him and his care and everything,
Yeah. During my research for this film, I found Wonders and Worries. Wonders and Worries is a nonprofit organization that helps children to cope with a parent's chronic illness. And they are the only organization in the entire United States that's doing this work. Luckily, Wonders and Worries was more than happy to open their doors to me. They invited me to their facility, they let me meet the families that they help, and they even let me sit in on their support groups that they hold for kids that have a sick parent and for kids who have already lost a parent.
Good morning. Come on in. We put Boudreaux right smack in the middle, so if you want to put a hand on him, you can.
So 1 year after my dad passed away, I traveled to Austin, Texas to visit Wonders and Worries and see for myself the amazing work that they do every day.
Guys, as soon as you sign in, if you can come sit down on the rug, we are going to get started. We're doing a medical play day, but we're talking about kind of pros and cons of back to school time, okay? So last month, everybody was saying, oh, we want to do some medical play. We haven't done that in a while. So, okay, we're going to plan. It's our back to school medical play day. Those of you guys who have not been to our group before, today's your first time. We have a thermometer that tells us 0 through 10. How are you feeling today? Okay, kind of think about your week, how everything has gone.
How did Wonders and Worries get started?
I was a child life specialist, actually the first pediatric oncology child life specialist in Austin. So worked with kiddos who had cancer, and we were adjacent to an adult hospital. Occasionally I would get called over to help support the children of a parent, usually in the very final phases of a parent's life. And having worked with kiddos that had cancer for a long time, I knew how perceptive they were, how much they were understanding from the very beginning. And I just couldn't help but wonder, what were those parents thinking and feeling as they were dying around how their child would cope with everything they'd been through and then their loss. And then also, as a child specialist, wanted to ensure that there was support for children when it was their parent with a serious illness. So I was just fortunate, having started some other child life programs, to be able to move forward. And at the same time, when I was doing that, another child life specialist, Missy Hicks, who had been in Atlanta, moved to Austin. She had also worked with children with head cancer, realized the same. And so the two of us joined forces and started Wonders and Worries.
How many times have you gone to the doctor and you think, oh, I wish I would have brought my whatever, your Lovey at home, an I Spy book, a stuffed animal, a squish ball, and you thought, oh gosh, I wish I forgot, I should have brought something. Oftentimes, the doctor's offices will have a book or sometimes one of those magic wands that you kind of look, but we brought a whole kind of bucket of examples to remind you that don't forget to grab one. Even if you're going to visit somebody, these are called kind of distraction items. Joshua, here we go. We're going to just try some different.
And there really is no one across the country that has the depth of programming that we have with the research behind it and the trained professional staff.
And that is really one of the things that led me to want to focus on expansion for Wonders and Worries. We need to create a world where anybody that needs access to our services has the ability to access them in some form. And so that is my most significant driver and mission, is making Wonders and Worries available to anybody that needs our services in the U.S.
And I know you guys have been through our Wonders and Worries group. Little wipey thing. Yes. Called alcohol. Yes. What does alcohol do, you guys?
It helps when your skin.
How does it help your skin? Cleans the germs and the bacteria. Alcohol, I want to see you guys rub the area on the doll where you're going to give the medicine. On the count of 3, give your doll the shot. Okay? 1, 2, 3. And push it slowly. The faster you push, the harder your wheel to flush. So nice and slow for your doll.
My name is Kim Fryer, and I am a child life specialist and program director here at Wonders and Worries, and I function in the role of a clinical program director, where I oversee our child life specialists and the direct support to the clients that we serve.
I'm Crystal Wilkins, and I'm the program director over operations, and I've been in this role for about 2 years. And I'm also a child life specialist and serve with clients directly as well. As we continue growing and expanding, I'm working with our team to help kind of systemize some of the things that we do to make it more replicable in new cities where we begin to offer services, as well as overseeing a lot of the program initiatives that we're doing to help put some of our support in different virtual formats. So our teen app, as well as our helpline, we're doing a lot of parenting ed videos that we can put online. So those types of projects I'm helping oversee.
So what does the alcohol do again? Justice, what does this do? It kills what? What is germs, the bacteria, because this needle is a foreign object and we're pushing it into the skin. So we don't want to push a bacteria or a germ inside somebody's heart, do we? This is really, really important.
So Wonders and Worries provides free professional support to all families, regardless of the stage or phase of illness, regardless of the family's financial situation going into an illness. Every medical situation causes financial stress. And we are grounded as a nonprofit in really the foundation of the child life profession, which our belief is that all children not only benefit from, but have a right to receiving information and support at their developmental level when they're faced with a medical challenge in their life. So we want there to be no barriers for families to receive support. And we provide support in English and in Spanish. And there's not a limit. We don't have a limit to say, okay, you've had 8 sessions and now you're done. Our goal is to empower families, so we never want families to become dependent on us to be able to cope in a healthy way. So we're regularly helping them recognize you have the tools and you don't need to come to see us weekly in order to cope well, but we're always here.
Like a saline flush, and look, you push it slowly. Where's it going? Where's the medicine going?
Into his blood.
Right into his heart, into his blood, distributing throughout his body.
Both Kim and I have been child life specialists for a number of years. For a child life specialist, our background is in child development. We've had training in hospital settings to learn medical terminology, to learn how to break down medical information on a child's developmental level. Here at Wonders and Worries, we kind of differentiate between what we do and what clinical therapists do, with the fact that we're preventative in nature. So we want to prevent distress before it happens. So we would like for every child who has a parent with an illness to come and receive our services before they're already having issues, before academic problems start coming up, before behavioral difficulties, because we believe that the illness education, the expressive activities, and the coping activities really build the foundation that they need to cope effectively and to be resilient, as opposed to waiting for some of those things to happen and then receiving support.
Of course, if a child is experiencing difficulty, we can start at any point along the way in helping them understand and cope.
Slowly. Okay, that's probably good. Take the shot out and wherever you want to go. Oh, and push.
I have a 8 and 11-year-old. Well, they just both turned 8 and 11. But like she said, my 8-year-old, she's been, since I've been diagnosed with my illness, she talks about it. But my 11-year-old, he's more reserved.
Okay.
So I don't know how to handle
how to support him.
Yeah.
Yeah.
Because he's more reserved about it, where she's very emotional, and she's all like, "You're gonna die, you're gonna die," and he's like, if he even thinks about it, he'll shut down.
So our first goal is to provide support, guidance, education to parents, to just kind of meet parents where they are and what are their concerns? What are their questions related to parenting their children? So it is very, very common that the first thing we're talking with parents about is how and when do they talk with their children about their diagnosis or treatment, whether it's a brand new diagnosis or whether it's something that's been going on for a while. We're regularly having those conversations. And then what are they experiencing with their children in terms of their coping? So sometimes parents call and they're just like, I just heard about you. I don't really know what we need. And so we'll just kind of start with, do you have any pressing parenting questions or concerns?
Children have different needs for information. And one way that I tell parents, if your child is more of an information seeker or an information avoider or just kind of really go with the flow. And right now with school starting, how many of your children were like, I need to make sure I have all my school supplies. I need to meet my teacher. Where is my classroom? What am I going to wear? I need everything ready. Yep. Those are your information seekers. They need more detail. They need more preparation. How many of you had children that were just like, wake me up, take me to school, I'm good. When I get there, I'll figure it out, right?
And sometimes we only guide parents over the phone and we don't meet directly with their child or teen. And we're available to guide parents over the phone throughout the country, which is really exciting. We have a fairly recently launched helpline. But then the next step after that is getting them connected with one of our child life specialists who geographically is, working out of the office that's closest to where the family lives. And then that child life specialist would meet with one or both parents or any adult caregivers to start to form that relationship with the parents. And then from there, start working directly with the children and teens in the family.
Tubing right there? Where do you think the tubing is going to? Can you see the picture on the, what is that? That's the heart. So the heart is the fastest way for it to move medicine through your body.
One barrier that I think a lot of parents kind of focus in on is, what if I don't know the answer to my child's questions? And the reality is that you aren't going to know the answer to every question. Doctors don't know all the answers to every question. And so being able to practice, that's a great question. I don't know how to answer that, but let me see what information I can find out. And then being honest when they don't have the answers, and that's okay. And they can sit together in the midst of the uncertainty, but they're going to be stronger together as opposed to sitting in the uncertainty apart.
I don't know. One of my faces that way. I want to make this. I want to make this cat.
Please sit like a lady. You both of you sit like a lady. Hey, Logan Smith. We're pulled together now.
It's okay.
Pulled
It's
together.
great.
Can you both talk about just how Wonders and Worries has been, how it's helped you?
It helped me get adjusted to what was happening in our family and just talk about that kind of stuff. And the thing with Wonders and Worries is sometimes with us they would do activities, which was we'd talk a little bit, but talking is good, but also sometimes you want to do something fun too. So I would always do a little craft with it, and it would be super fun, and it was really helped us get used to it. They brought these therapy dogs in a couple of times, and I remember that was kind of fun. It was cool to talk about in a group.
I like how you got to see what everyone else is kind of going through, so it's not you weren't just oh yeah, I'm the only one that has a parent with the illness, a lot of other people do. Good job.
We believe that you can't just say you do something, you have to prove it. And so for us, being able to validate that what we do actually works through rigorous clinical trials and clinical research is extremely important. And so we've been partnered with the UT School of Social Work for multiple years around that, and have just completed a first significant clinical trial that essentially validates that what we do in our succession curriculum not only works in the immediacy of actually going through the curriculum, but actually has staying power beyond the curriculum, which is exactly what we want. We want kids to be able to be helped in the here and now, but also have the tools to be able to continue to help themselves in the future. And I think that is an important differentiator for us is really believing in this, having a solid clinical foundation that's research-based to be able to not only say that what we do works, but prove it.
And I do want to give families who might see this film hope that, if they haven't had support, which most families haven't, and they maybe haven't had conversations that they want to have, it can start at any point. At any point in time, a parent can say, okay, this is a good time now to revisit what's happened before, to reestablish a connection with my child, or, so I just truly want parents and professionals who might have been going through this journey and found that the families become compartmentalized and everybody's kind of isolated from each other, that at any point that healing can start.
Start us off with your introductions, and then how about who in your family has passed away?
My dad passed away when I was 4, and he died from cancer. And when that happened, I was sad. I was sad.
Way down here. Mm-hmm.
Wonders and Worries, how is that for you? What do you like about it? What do you do when you go there?
He helps me with when I'm like stressed or something. We do all these projects, all these like activities that are fun.
You have your little project, the one with the hearts?
Yeah, I still have it.
Yeah, do you want to grab it?
I'll be right back. All the people I can remember.
So will you explain what that is?
Here, this is, these go to the people that I love.
And so when you made that, what was that supposed to help you remember?
It was help me remember my family. I'm a little bit sad because, today was my mom's death day.
On that album, it was the exact day.
My death day.
Mm-hmm. And just this morning, or did you talk about this week?
This week.
Okay. It's really good to talk about it out there. But it's kind of a blue day.
The anniversary for my dad was on August 15th.
Wow, just a couple days ago, so you guys have that in common. Yes. That's a day and that time of the year. It's probably you'll think about it for a long time to come, that day is memorable because it's the day you lost your dad.
So in the same way that we incorporate conversation through play, parents can look at how does my kid naturally open up and pay attention to that and to be able to start the conversation there, as opposed to like sitting down and lots of intense eye contact and all of that kind of stuff. Kids can't necessarily always do that. And so that's usually, I think, a really helpful tip is just how can you have this conversation more organically.
We're a nonprofit that operates 100% based on the generosity of individual contributors and foundations. So we don't receive any public money or healthcare reimbursement. So financial support is something that can be done to help fund our programmatic initiatives and our desire to expand. And then the second area is they can help us help more people. So they can refer our services to anybody that they know in the community that's in need.
And going to our website, we absolutely utilize our website, and we'll be utilizing it more and more as ways for us to be able to share information and support others, but also for others to be able to kind of look through and determine, oh, I have this skill set. Wonders and Worries need some IT support, or we're working on some virtual reality types of things. So maybe somebody has a skill set that they think might benefit us as we work to serve more families. And in-kind donation of time and talent is always appreciated.
And the other thing I think has to do, as Alex was saying, just more with awareness. When you explain to somebody that support is needed to help guide parents and then ideally provide direct support to their children, parents go, well, of course. Yes, people recognize that. But in today's medical world, when we're talking about family-centered care, that often extends maybe to the adult caregiver partner, but family-centered care still doesn't mean, in many places, reaching down to support the children that are within that family and directly related to that patient.
There's a tremendous amount of focus and support and services that are oriented directly towards the affected individual. but you start to lose kind of that visibility and once you go outside of that affected individual. But it is sort of common sense. Once you bring up to someone, hey, your kids might be struggling with this, then they start to notice the symptoms of the struggle and want to take action, or even people that aren't going through it go, of course, yeah, that would be a stressful time.
And I feel compelled to say that, children are so perceptive. They often put on a brave front to protect their parents, who, whether it's the ill parent who's struggling with their diagnosis, treatment, side effects, or the caregiving parent who is burdened with additional responsibilities financially, etc. They may not share how worried they are unless given that opportunity.
Okay, I think we got everything. Unless there's anything that you guys think of that you really want to say, or that anything that we didn't touch on.
I want to thank you.
Yeah.
I want to thank you for being brave with your own story and courageous enough to give back to kids that need support, and you were one of those kids. And so the fact that you are brave enough to be able to share that and to shine a spotlight on this need within our community, within every community, for kids that need support. And so thank you for being brave and using your talent to be able to give back in this way and pay it forward.
I just really want to spread the word about the work that you guys do and the importance of this issue. So you guys are helping me do that. So thank you.
Thank you.
So congratulations. Yeah! You just wrapped the last bit of footage you needed for your documentary.
Yes, 3 years later.
3 years later. I want you to acknowledge yourself, acknowledge this last 3 years, and really take a second and honor yourself.
It's funny because as you were saying that, I'm just like, I wish my dad was here, you know?
And my only other final thing is the same thing to my family. Say, hey man, let's just endeavor to persevere. What else can we do? You know?
We're done.
Okay.
Woo!
Hope you got what you needed, baby.
I did. Thank you very much.
You're welcome, honey.